Well, thank you very much, Rich. Can I call you Rich for
Please,
this? Is that
please,
okay? We'll be
yeah.
a little bit more casual. But obviously, you've seen his bio, extremely impressive and an expert in this area. We're going to, of course, talk about the need and the vision that you have, a future where children's health is a right and not a privilege. And I do know that there is an emphasis on a celebration of joy that's happening, a gala later today. So I promise I will get to the joyful part. But I want to start really because we are in some perilous times. So I do want to start with the serious and critical questions. Rich, if I put my glasses on, the stats are coming, okay?
Gotcha.
So that's what it means. First and foremost, I mean, just if you would give me a sense of really what is the one thing that keeps you up at night?
Yeah. Well, first, thank you, Starsky, for the invitation to be here. It is absolutely wonderful to be in a room of people who care so deeply about the future and health of children. The mission of Children's Defense Fund and the work of RWJF are so well aligned that it's a real honor to be here. So what keeps me up at night? I used to say nothing keeps me up at night. I'm a really good sleeper. But this year I've been up a lot at night. And what's kept me up at night is the fundamental rejection of this idea of what America could be and the intentional actions that have taken place to erase large parts of society. And the way that's playing out when it comes to children's health is that we are seeing so many of the fundamental factors that are required for children to have the opportunity to lead healthy lives be taken away. And it runs the gamut from the battles that are taking place right now around should children have a right to food, and the cancellation or the failure to provide funding to SNAP, the Supplemental Nutrition Assistance Program.
We're seeing that play out today. There's still a defiant administration against actually seeing that funding go forward.
And the courts that have said,
yes,
you must provide this money right now. One of our grantees was involved in that lawsuit, put forward that lawsuit. But yet the money hasn't flowed, which means that there are children in America who this week are saying to their parents, I'm hungry, and their parents are not able to say, here is some food. So that keeps me up at night. I'm a pediatrician, I'm a public health person. The wholesale destruction of our governmental public health system keeps me up at night. And in particular, the lies that are spread about immunizations and vaccinations in children's health. That keeps me up at night. Because, I used to say as a pediatrician that there was nothing I did in that role that had more proven value than making sure that the kids I was taking care of were vaccinated fully and on time. And I still say that. I'm not seeing kids anymore. I stopped a couple years ago. But I still say that, but it's not something, it's something that is challenged as opinion rather than fact. And the facts and the data, I'm an epidemiologist, I love data. And the data show that vaccinating your kids on time and fully is one of the best things you can do to make sure that they don't succumb to something preventable. Yeah. So there's a lot keeping me up at night. But I have to say I slept pretty well last night.
Okay, good. I think I know what you're talking about. Tell us what it means when you hear about something at a fundamental right and that children have a right to health as opposed to a privilege. You think of the law and how do we enforce that notion that this is a human right for children and what policies could perhaps protect the children's rights?
Yeah. There is a false story being told that someone's health is primarily dependent on the decisions and choices that they make. And that if you would just teach people the right thing to do. Children would be healthier, adults would be healthier. I grew up in Princeton, New Jersey, a very wealthy community in New Jersey, in Mercer County. The life expectancy at birth was 89 years. I practiced pediatrics at a federally qualified health center, community clinic in Trenton, New Jersey, which is the capital of New Jersey. It's also in Mercer County, same county that I grew up in. It's 14 miles away. The life expectancy at birth is 75 years. 14 miles and 14 years difference.
Jeez.
So when I think of what does it mean for health to be a right, it means that a child, how long they live and how healthy their life is not dependent on where they happen to be born. And so I say, well, why don't those kids and families in Trenton just move to Princeton? That would take care of it. And yeah, we all laugh because the barriers to opportunity, the barriers to moving to communities of opportunity or creating communities of opportunity in the communities that people are in are so extensive. And right now, those opportunities are getting harder and harder. But for it to be a right, we have to believe that everyone in our country should have the opportunity. Every child in America should have the opportunity, the freedom to dream, and the opportunity to see those dreams come true. And that isn't the case right now. And so we are fully committed to addressing those barriers. And in America, the biggest barrier is structural racism.
So explain that, structural racism, because you've written about it and we've discussed it in terms of like human beings having different value.
Yeah.
So all of the policies and the money and the resources treat human beings differently because they've placed a different value on them.
Yeah.
But we're in a society, in a moment now, where even you talk about diversity, equity, inclusion is an extremely divisive idea.
Yeah.
So how do you even broach the subject? How do you get people to understand when you explain it? This is real.
Yeah. It's a challenging time to talk about racism. It's never been an easy time to talk about racism. There was a window during the COVID pandemic and following the murder of George Floyd where in America we were saying we're in a moment of racial reckoning. We're talking about these things. And it actually allowed us as a foundation to pivot into this space because it is so fundamentally important when it comes to health. But structural racism, for our foundation and board, it became so clear during COVID. When you look at why Black Americans were more likely to die during COVID, they were less likely to be in a job that had sick leave, less likely to be in a job that had family leave, less likely to live in a home or an apartment or a house that had that extra room that you're supposed to go into when you have COVID. The CDC, I worked at CDC for 13 years, and the guidance that came out during COVID was, if someone in the house has COVID, you should put them in their own room and they should have their own bathroom to use for those 14 days. And if you look at who is less likely to have that ability, people of color in America. And it comes back to opportunity and the opportunity that hasn't been there. If you look at who is more likely to have to work, to be an essential worker during COVID, people of color were more likely. And the reasons for that weren't individual choice, it's what opportunities were there. And that's how structural racism comes in. If your opportunities are dependent on the color of your skin, then that is a sign of structural racism. And making that clear and rooting that out is critically important. And we are unapologetically continuing this work and lifting up these messages, learning to talk across to different groups in different ways. But the idea that the promise of America, this idea that this is a land of opportunity is only available to some people in this country should be fundamentally abhorrent to American people.
How do we specifically address the need and really the crisis with Black women giving birth? I mean, we see them dying in unimaginable numbers and suffering just having a child. Explain how the foundation and how the people who you support are dealing with those critical times of a child's life, including just that one moment that the child is born.
Yeah, I mean, the idea that in America, a Black woman with a PhD is more likely to die during childbirth than a white woman with a high school education. I mean, why is that? You have to dissect that. And there are a lot of reasons for that. Some of it is interpersonal racism, how people are treated in the healthcare system, the fact that we lack diversity in amongst our healthcare providers. There are other aspects of this that have to do with access to healthcare. Trenton, New Jersey, I was talking about Trenton a minute ago. There's nowhere in Trenton, New Jersey that a woman can give birth. There's not a hospital in Trenton, New Jersey that provides maternity care. I think Lawrence Township, which is the next town over, is the closest place. That matters. If you don't have access to care in your community, if you don't have access to providers who are providing respectful care. So we're doing a lot of work in that area, in particular in New Jersey, working to make sure that doulas have the opportunity to practice and provide services. We are providing resources to Black women's organizations that are focused on meeting the needs of people in their community. One of the things that really worries me, though, is we're talking about data and the differences in outcomes. During COVID, there were real challenges across the nation in really shining a light on health disparities, who was being impacted the most, which communities, which populations. And so we funded a commission to address what needed to change among public health data.
Sure.
You know, what has to be collected, how is that going to be shared, so that you can, the way public health works is you identify a problem, then you can come in and look at the root causes and address it. So we put $50 million into the recommendations that came out of that commission, funded a lot of projects. Almost every one of those projects now, they aren't working on expanding what data is collected. They are working on saving the data that is being taken down and hidden.
That's right. That's right.
And so, as we talk about Black maternal mortality, or we talk about infant mortality, or we talk about all kinds of health issues that affect children, if they're being hidden, if we're not able to track over time what's taking place because the data is going away, then we're at we have real problems.
Yeah.
And so, this idea that one of the things keeping me up at night is that there's no concept of shared facts and knowledge. You can disagree on policy objectives, but if you aren't looking at the same data, if you're not, then it's really, really hard.
Yeah, and I know there are certain organizations that are at least trying to preserve some of the data, the history makers and others, just to hold on to what we already have. You and I have something in common. I know that Howard University, very dear to your heart, on the board, as well as Board of Visitors for Howard University Hospital, and my father was the dean of Howard, the medical school for many years, and you talk about representation. So, just a personal aside, when my father was growing up and he and his buddies were all at Howard and they were getting their education, they all, they had something called professional courtesy. So in my world as a child, all my doctors, the dentist, the eye doctor, the pediatrician, were all Black. And that was my experience because they all worked together and had professional courtesy where they would treat each other's children for, different reasons, and we didn't have to deal with insurance and all that kind of stuff. And so even when we were really little and, we're at the kitchen table and he's calling his neighbors, somebody's busted their eye and they're about to do stitches at the kitchen table, it's like, Dad, you're an allergist, come on, is this real? But he and his buddies, they thought they could do anything because they were doctors. They were young doctors, young Black doctors, and it really wasn't until college when I had my first white doctor and had to deal with health insurance. So that was a learning experience. But representation is so important when you grow up and you see people who are like yourself and you see like your parents who are striving and achieving, and then part of the medical profession where they truly care. Talk a little bit about the representation factor, because we're just seeing the numbers, even in the HBCUs are trying to catch up, but they can't, you know?
It is a real challenge. I mean, there are a lot of studies that show that black patients get better care when they're being seen by black physicians. You have to ask the why behind that. But in addition to asking the why, you have to ask why has the percentage of physicians who are black not increased over the past 40 years? We as a foundation, it's about 5-6%. We have invested in pipeline programs since our founding to try and increase the number of physicians of color. And I can tell you, after 40 years of doing those programs, that they're not working. The numbers haven't changed. I think it's something like 70% of black physicians in America were trained at an HBCU. And the efforts to increase the enrollment in primarily white institutions has been an abysmal failure. And with the current Supreme Court and administration, the opportunities at primarily white institutions will continue to decrease. So we are investing more and more in HBCUs. And Howard at some point would love to double the size of its medical school
Talk
class.
to me a little bit about what we talked about backstage. What's the game changer? Even the number. Can you talk about that number? What's the investment at the HBCU level that would actually tip the scales and make a difference?
Well, if you look at the endowment of Howard University, it is the best endowed HBCU. It just crossed $1 billion. And it's like, whoa, that's a huge amount. If you look at what most universities with medical school have, you're talking at least 10 times that. I went to a small liberal arts college. I think our endowment is like $7 billion. Howard University provides phenomenal education on a shoestring. And so, my call out to some of these very deep-pocketed philanthropists, why don't you give $1 billion to the endowment of every HBCU?
$1 billion.
$1 billion that has a medical school.
That's right.
That's transformational. We were really thrilled that Howard received, I think it was $63 million from Mackenzie Scott this week, which is fantastic. But I would love to see, Bloomberg gave $1 billion to Hopkins, which was great. He gave $170 million to Howard, which is great. But I'd love to see someone with a B. Someone give $1 billion.
A B, yes.
That would be.
Well, I'm on the board of Xavier's, board, and we're working on establishing and building a medical school. So I'm going to put that plug in in case there's a billionaire listening. So I put my glasses on because we're going to get to some numbers here. So I'm sure you've seen the Make America Healthy Again report, the MAHA report, 20 pages, 128 proposals. In a nutshell, what do they get right and what's missing?
Well,
in a nutshell.
How long do we have? So first, the name, Make America Healthy Again. Tell me when America was healthy. And tell me who in America was healthy. So this idea that there was this idyllic period in our nation where we were all healthy and now we're not, it's just not true. I mean, over the course of the past 100 years, life expectancy has continued to increase. Over the past few years, there's been a dip. But this notion that everyone was healthy is nuts. The idea, though, that there is a problem in America with chronic disease that we could address, I'm fully on board. Fully on board. Let's look and see what are the most critical chronic diseases, how do you prevent those diseases, and let's tackle them. Let's tackle them together. You know, I worked in the federal government for 13 years at CDC. I ran emergency preparedness and response for 4 years during the Bush administration. It was never political. It was never partisan. It was public health. You know, and so let's take on chronic disease. So the MAHA report, this is laying out what we really need to tackle as a nation for us to be healthy, in particular for children to be healthy. The number one preventable health issue in America relates to smoking. Smoking is not even mentioned in that report, and the secretary eliminated the Office of Smoking and Health at the CDC. So that's just the first incredibly absurd thing in that report. The secretary rightfully puts a lot of focus on nutrition. Nutrition is absolutely critical to health. Having access to fresh fruits and vegetables. When you go to the supermarket, being able to shop the perimeter rather than the center part. The center part is where all the processed food is, all the fresh fruits and vegetables and meats and fish and stuff is around the outside. So being able to have access to that is critical. Well, if it's critical, why did the secretary support a bill that slashed SNAP? Which gave money to people to allow them to afford food? Why did they cut the program that allowed farmers to bring farm to table to individuals in need? Why are they pushing back on people being able to use SNAP at farmers markets? I mean, it's absolutely, the focus is on food dyes. Well, I don't want to eat food dye. No one wants to eat food dyes. But the idea that eliminating food dyes is going to deal with the nutrition issue in America is ludicrous. What you want to do, if you really care about children's nutrition, during COVID, we saw across the nation universal school lunch program go into place. We saw increased funding for school lunches. We saw increased funding for SNAP. All of that went away. But those programs that put money in people's pockets, direct payments to families, extended child tax credits, the expansion of SNAP, we saw hunger in America among children plummet, absolutely plummet. And you're saying, wow, Congress can just make this all permanent, and we will have reduced hunger in America. We will have made it easier for parents to give their children the food that they need. And they let it all expire.
Rich, talk about the vaccines again, because I know that that's extremely important. You mentioned it before, but you've been across the world and you've had your own global experience as a pediatrician. You've seen firsthand what it looks like when preventable infectious diseases crop up again, including polio.
Yeah.
Your own
now you'll get me going. So vaccines are absolutely miraculous. I trained as a pediatrician in the early 1980s, and I can remember talking to a parent whose child had meningitis. That it looks like your child is not going to see again, or your child isn't going to hear again, or your child is going to be significantly impaired. And then when vaccines against the leading causes of meningitis, Haemophilus influenza, pneumococcal disease, meningococcal disease, those vaccines came around. People who are training in pediatrics now never have those conversations. There are families who've never had to experience what it means to have those infections. I started my career doing public health work in Bangladesh, and I remember in Bangladesh seeing a patient die from tetanus. When I spent 8 years at ABC News as medical correspondent, and I did reporting on the global effort to wipe off the face of the earth polio. And we've gotten close. We're slipping back, but we've gotten close. As part of that, I went to India, to New Delhi, and I reported on this mass vaccination campaign to give every child the polio drops. At that time, it was you could do it with drops. And we went to a train station. The train pulled in. The windows of the train car dropped down. Mothers held their babies out the window, and we put drops of polio vaccine in their mouths, and the train took off again. It was like a day to vaccinate every kid. It was the most beautiful thing I'd ever seen. As part of that story, we also went to a hospital in New Delhi that was taking care of polio survivors. So seeing people on ventilators from a disease that's preventable. And now we have a Secretary of Health who believes that vaccination should be simply a matter of choice. And he is doing so much to instill mistrust in our vaccine system. Data this week show that people's belief and trust in the measles vaccine has gone from 92% down to 80%.
And so that, I mean, I see you're tearing a little bit. It's an emotional, obviously it's emotional for so many people because you think about what could be, right? And what is and what we're losing now. So give us a little sense of the pushback here. Like how do we confront that? I mean, how do we make sure that our society is not going backwards?
Yeah.
And the trust issue, which is also so important.
Well, you know, I think I'm in a room full of people who believe that we can make a difference, that we can change, that advocacy matters, that voice matters. You know, I think that earlier this year, many people had this sense of helplessness and hopelessness just because of how much was coming at once. But I truly believe that we can push back and we can make a difference. We're seeing efforts around the country. We're seeing people coming out and saying, no, this is not acceptable. You know, I used to say to folks, if you want the best information about health, go to the CDC website, you know, and see what they say. I don't say that anymore. And to me, talk about something emotional. There's nothing prouder for me than the time I spent in government service working at the CDC with people who are committed to improving health and creating opportunity for health in this country. And the people who are working there are still at it. And you know, a lot of them have been furloughed. There's 700,000 federal workers who are furloughed, who aren't getting paid. There's a lot of workers who are working and aren't getting paid. My hearts go out to them and their families. I also, you know, I really worry that when you have an institution like the CDC and you can't say that you trust the information that's there, that's a fundamental problem. You know, the Secretary of Health disbanded the committee that advised CDC on vaccination policy. And it was made up of experts who knew, and they went through the data and they made recommendations. But the idea that what we're seeing in Florida, where the Surgeon General said that vaccines in Florida for children going to school should be a matter of choice. Well, I'm a parent. My kids are grown. I would have been terrified if my kids were going to school and they were going to be sitting next to kids who were unvaccinated. Because no vaccine's 100% protective, and one of the ways that you're protected is by the people around you being vaccinated. And we've got millions of people in this country who have immune disorders that either won't, you know, make it dangerous to get vaccinated, or vaccines don't work. And why don't we have a responsibility to help protect them by being vaccinated? So this idea that we're not responsible for each other's health, that within communities we don't have this shared responsibility, is something we have to speak out loudly against. Because I don't believe that's true. I think most people in our country believe that we are connected to each other, we are social beings, we're responsible for each other, and what we do isn't just a matter. There are things about belonging to a community that we do that maybe we wouldn't even want to do. Paying taxes is one of those. But you do it because it's part of being part of a community.
Before we start opening it up for questions and answers from the audience, Rich, I actually want to quote yourself back to yourself. Because you talk, no, but this is to your point. You talk about the role of hope, and I just find this amazing that you feel this way, because you say, people intentionally created the unfair systems and structures that exist today. It is that intentionality that gives us hope. It means that together we can intentionally remake them.
Yeah.
Like, it's that bad, but it's better, and it can get better because that's our intention as a community.
Yeah. I mean, we made these systems, and we, as a foundation, this is a moment for philanthropy to do more. When you look at, one of the things we talk about at RWJF is risk. And who is at risk in this moment, and whose risk are you centering? We as an institution are constantly calling out whether we are centering our risk too much. And what can we do to help ensure that our grantees are able to do the work that they're doing? So CDF it's critically important that the organization is able to advocate and push for policy change. There is risk in doing that in this moment. And so for us, we are not elected to our positions. We don't have shareholders. We are fully endowed. So for us, we need to lean into this moment and make it easier for people to do this work, because we need to make sure that these systems are systems that generate opportunity for health. And we haven't even talked about how horrible our healthcare system is when we're talking about systems, but that's one of those fundamental systems that's critical to health that has to be remade in a way that works for people, and it's not.
Do we have some audience members that would like to ask questions at this time? I think we have a couple of microphones, folks with microphones that can get to them. Do we? Looks like there's somebody there with a microphone. Okay.
I'm a youth policy consultant, and so I recently graduated from Texas Southern University, like this past May, and I hear you talk about Howard a lot, but how have you used your voice to advocate for the lesser-known HBCUs and creating pipeline programs there? Because I know, like, being at an HBCU, like, we hear Howard all the time, like, and it's a great school, but they get a lot of funding. And at TSU, we get some money. We get more than some schools, but I rarely hear people use their platform to advocate for other HBCUs other than Howard and Spelman. So what have you done for other HBCUs?
Yeah.
That's good. That's a good question.
Thank you for that. I talk about Howard a lot because I have experience there, and I'm on the board, and I'll have to be careful in terms of my words. I lift up Howard because Howard is the best endowed and is still in a position that is precarious. And I know that there are many HBCUs that are really struggling financially, especially in these times. When you see the government cutting grant funding for students, that puts increased pressure for sure on all universities. And HBCUs that are financially on the edge. So thank you for that.
Okay, do we have someone on this side? It's hard to see you, so if you just wave a little bit, the one with the microphone, so you can. Good, thank you. Okay, we got people over here. Got lots of questions. This is great. And we've got people on this side as well. Okay.
Hi, I'm Kiani Igwe. I'm with Democracy Forward, and I heard that you said that pipeline programs have not been working, and then given SFFA, they're even less likely to work. And you mentioned like philanthropies have to step up. Are there other factors or parties that can help those pipeline programs work? Is it just more investment at HBCUs, or are there other factors at play about why those pipeline programs have not been working and what we do in response to SFFA?
You're with Democracy Forward?
Yes.
So first, I just have to say thank you for all you do at Democracy Forward. The media is not covering the wins enough because you and other organizations that are taking on these actions by the administration are winning, and winning big time. And that gives me hope. And it's important that we share that because it's so important to know that what is doesn't have to be what will be. So thank you. We're rethinking what pipeline work could look like. We are funding right now some work to helped stand up a new HBCU medical school. We're funding work for collaboration amongst HBCU medical schools. But it's, I always come back to Trenton and Princeton. And I think that one of the reasons pipelines don't work so well is that the systems and structures that we're talking about that are so inequitable, we fund in New Jersey and in most states our public education off of property taxes. So Princeton, New Jersey has some of the best public schools in our nation. Trenton, New Jersey does not. Trenton, New Jersey gets the books that Princeton's done with. And if we don't address that fundamental inequity, starting a pipeline program when someone is in high school or college, it's late. It's late in the game. So I think that often we're not going far enough upstream to address root cause. Public health, that's a big issue. I think that we saw in 2020 and 2021 over 200 public health departments around the country declare racism, structural racism, to be a public health crisis, an emergency. We're not seeing much being done about that, and we're not seeing many use that language anymore. But it is a public health crisis, because if you don't address the fundamental barriers that are baked into various systems, whether it's the fact that people aren't paid a living wage, or issues around housing and housing access, but education is a key piece, then you're not going to be able to get there further down the line. I think that's what one of the big issues is.
Let's take someone from this side. Thank you. What's the time? What is the...
Thank you. Arthur Jones II with ABC News. Dr. Besser, we may have been colleagues at one point in time. I cover the departments of education and health, and you talked about how the wholesale destruction of the public health is keeping you up at night. Can you expound on what that means really for the future of public health, and if it keeps you up at night for the next 2 to 3 to 4 years that the Trump administration is in office, what that could mean for the health agencies of this country?
Yeah.
Thank you.
One of the things about the public health system is that when it's working really well, it's invisible. You don't see it. You go to a restaurant and you have a meal, you don't walk out there saying, wow, I didn't get food poisoning. That's really good. Or you go to the swimming in the swimming pool and you say, oh wow, I didn't get sick from swimming in that swimming pool. Or I walk down the street, wow, feels good. I can breathe the air. You're not thinking about it when it's working, but when it's not working, it's like, well, why didn't someone inspect the kitchen in that restaurant? Why did I get food poisoning on that? And why isn't somebody testing to make sure there's chlorine in that swimming pool? And, what happened to the air quality control that was measuring, what was in the air so that, my kid's asthma isn't flaring up? I see it as well on the emergency side, because I started my career as a disease detective at CDC. Earlier this year, Milwaukee was dealing with an issue with lead poisoning in the water system. And they called CDC for assistance, which is what normally happens. Normally, you call CDC, CDC sends out investigators to help state and local health departments deal with that. The office was gone. The office that dealt with lead poisoning was no longer there. So there was no one there to help that city deal with that health crisis. I led CDC at the start of the H1N1 pandemic in 2009. And it was a period where public health, people's trust and faith in public health was off the charts at the federal, state, local, tribal. We commissioned polling. It was extremely high. Trust was very, very, very high. I can't tell you when the next pandemic will come, but I can tell you there's going to be one. And I can tell you that when the next pandemic comes, we are nowhere near ready. Because people want to go into public health. Young people want to go into public health. They want to make the world a better place. But when CDC has lost a third of its employees. I've had friends reach out and say, yeah, my kid, they were working at CDC, they just got laid off. He was in the injury prevention center, the job's gone. Oh, he's a public health advisor, they're all gone. Well, that's the future. Those are the future leaders in public health. They're the folks who are responding in communities. So we have to do a better job at making the invisible visible. And
How
part
do
of
you
that
do that?
Well, it's telling stories about its stories. We talked about this before. Stories really matter. Data don't resonate, so we can talk about 2,000 workers at CDC lost their jobs. It's like, oh, that's really bad. But hopefully it connects a little more that Milwaukee wasn't able to talk to somebody about their lead poisoning problem. We have to tell the stories about where it doesn't work and where it works. And in America, we had 2 children die this year from measles. 2 children died from measles. That's not something I've had to say in my professional career.
So it's back.
It's bad. It's bad. And you say, well, it's just 2. It's like, whoa. Let's have a conversation with those parents, with those brothers and sisters and those grandparents. What does that mean for those children to not be here when it was preventable? When it's preventable. That's the thing. And there's so many preventable issues in this country that we haven't wrestled with. Gun violence prevention, things that are so critical where we could be making a difference, where we can't even talk about it. So I really worry about the future of public health because of what we're seeing right now and because of how public health was demonized intentionally for political gain during the COVID pandemic. And it continues to this day, where people who are there trying to make create opportunity for health are being demonized.
And silence, perhaps, as well,
That's
to your
right.
point about communication. Can we get another question? There seems to be a number of hands raised back there.
Hey, Craig Logan here with the E3 Foundation. So I have a question around kind of funding, right? So you kind of talked about that, I understand what the organization is too as well. What I found too, like oftentimes, determinants of health are oftentimes addressed on a very ground level, right? On a very grassroots level. So I like to ask how, when it comes to funding, right, organizations that are big, right, do great work, but also smaller organizations do great work too as well, right? So how in your funding stream are you ensuring that equity is built in the grant applications and the processing of the grants from that same great big organization to the organization that also is on the ground too as well? Like, how are you training those people who are processing the grant to make sure that they're looking at it from the equity lens, and the organizations that do great work on a grand scale also receive kind of the same mindset, thought processes as the organizations who are very on the ground level doing that work too also?
Yeah, thank you for that question. There are real challenges as a large national philanthropy, understanding and addressing needs within community. And we're in the process of looking really critically at our history and our performance and ways in which we've done harm through the work that we've done and the approaches that we've taken. And one of those is centering large academic institutions, other large organizations as the hubs for work that's taking place in community. And we are trying to shift that. If you look at a lot of our work around Black maternal mortality, instead of funding a large university that is then dispersing community grants, we've been working to center organizations that are closer to community to then do that disbursement. It's very hard for us to make grants at the community level, so we work with groups in between, intermediaries, to try and do that. But who we select in those seats is really important. and we're working to try and do a better job of that. We're engaged in funding collaboratives with foundations that are based in community. Some of that is to provide them with resources, but it's also for some two-way learning about how we can do that better, because it is an area where we've really struggled.
Another question? I know there are a couple of people in the back there.
Good morning, everybody. My name is Dr. Andre Brown, and I'm with Friends of the Children, and I'm a psychologist by training. And one of the questions I struggle with is, what language do we use to shift the narrative that the policies that are being put in place are actually hurting the people that are putting these policies in place? So it's like, from a liberation standpoint, it's like, well, we know it's white supremacy, we know it's gender-based, we know all these things that are happening, right? All the disparities. But even in that, you're still hurting poor white kids, you're still hurting women, you're hurting your mothers, your sisters. So what can we do to shift that narrative? Because that's where the struggle doesn't really make sense to me still. And I understand voting against your own self-interest and all those things, but what would you add to that?
That's a great question.
Yeah, that's a really important question, and it's one that we're really interested in. We invest a lot of money around narrative and narrative change, and as well as communications research of how do you talk to different audiences about these issues in a way that creates opportunity for connection and forward movement. This past weekend around the SNAP cuts, I wrote an op-ed for Fox.com, and I was on Fox streaming, and we're trying to work on how do we talk to an audience that is more conservative, an audience that may see issues from a different perspective. And it's really, really important. I think that across the board in America, there's an economic crisis. There is a large population in this country who does not see the opportunity to succeed. And that cuts across every racial group that there is. As I've talked about the Medicaid cuts that came in the reconciliation bill, I spend a lot of time talking about the impact on rural hospitals, on rural communities. And rural communities are white communities, they're black communities, they're brown communities. It cuts across the board. But talking about how that's going to impact, that these cuts to Medicaid are going to be the difference between there being a hospital in your community and you having to drive 50 miles. And what does that mean if you have to drive 50 miles? When I was talking about the SNAP cuts, not only did I talk about the impact on somebody who can't buy food, but what about the farmer who's growing food that no one can buy now? And what about the rancher who's raising meat that people can't buy now? Or the person who's working in or running a grocery store that people aren't buying food in? The ripple effect of, the government spends $8 billion a month on SNAP. The ripple effect of that in the economy, it's not just the people who are receiving those resources, who are majority white, who are not getting those resources, but it's the places those dollars were being spent. So, we do focus group work to try and figure out, all right, what's the best way to get at this? How do you provide this? And a lot of it is you have to lift up the problem, but you also have to lift up a solution and a way out, and give hope. And that's really important. If you just leave people with the sense that everything's broken, have a good day, it's like, oh my God. But it's like, oh no, actually, there's something that can happen here.
And it's each person's path, right? Because it gets overwhelming. But if you pick a path,
that's right.
Your specific area of expertise, and say, I'm going to go all in my field to do something better, to make it better.
And I think it's even more local than that. It's figuring out, how do you talk to a neighbor who doesn't agree with you on everything? How do you see them as more than who they may have voted for in an election? And how do you make that connection? It's so important that we figure that out, how to build some of those bridges, because there is more commonality than we hear about in the media. We hear about the incredible divide, but I know here there are a lot of faith leaders, and in faith communities, people don't agree on everything, but there's a commonality that brings people together, and if we can tap into that, I think we're gonna make more progress.
That's great. We're going to take this last question up here, and then we are going to wrap.
Greetings, beautiful people. My name is Donna Thompson-Bennett. I have the joy and honor of serving as the Executive Director for the National Parent Leadership Institute. Our work includes system capacity building and working in partnership with organizations like National Healthy Start Association. However, those organizations have been impacted by federal funding in cuts or limitations, and they are doing the on-the-ground work that the gentleman across the aisle mentioned. There are Healthy Start consortiums throughout our nation, and they're working in communities, urban and rural, and addressing maternal-child health issues. However, their funding, their very existence is being threatened. So my question, as they're seeking to actually work on policy that addresses the social health determinants in their community. So in a place like Mississippi, Tougaloo to be specific, transportation, just being able to get to a doctor, to a healthcare facility, to have the appropriate prenatal work addressed for a family, for a child to enter into this space healthy, and for the mom to remain safe is an issue. Before we even get to the lack of actual medical care, you mentioned that a lot of your work, Dr. Besser, is actually addressing grassroots organizations. So I'm coming on behalf of a friend, which is unusual. I'm not coming on behalf of my own organization, but wondering how do national organizations that have grassroots consortiums throughout the nation gain access to the opportunity to get funding from your organization? Because they need it.
Yeah. When you look at the massive federal cuts, across the board, and the destruction of so much at once, philanthropy is part of the solution, but it's not going to be able to fill that gap. And I hear stories like yours many times every single day, as well as so many other stories. We need to push back. We need to get the federal government to meet the needs of people. We need to ensure that our elected representatives are doing their jobs and are meeting the needs of people in our country. Because philanthropy can do more, but can't begin to scratch the surface of the need that exists. Just thinking about the issues that we've talked about here. I said the government spends $8 billion a month on just on this supplemental nutrition assistance program. That's unbelievable. And when you look at what the government spends on health care, philanthropy can't fill those gaps, which is why we are so focused on policy change, because policies are critical. Making sure that people in communities have access to affect the change that they see is necessary in their communities is critical. And I know we're wrapping, and I know one of the things that's so important to Children's Defense Fund is joy. Finding the joy in this work, finding the joy in a victory, in a pushback, finding a joy in a narrative that says that the promise of America is attainable, and that we have to fight for it. That brings me a lot of joy.
That was my last question, the role of joy. So he wrapped it, he did it. Thank you so much.
Thank you.
Thank you. That's amazing.